There's 8 steps in the process to get CAR T-cell. You have to identify the patient first, and then you have to make sure that that's the appropriate therapy for the patient. You need to have a line placed in order for us to collect your T-cells. So it's an operative procedure where we put a large bore IV in a big vein. With the apheresis procedure, we have a prescribed dose of cells we want to collect. The apheresis machine is a cell separator, so it actually can figure out where your T lymphocytes are, take out those, and return all the other blood products. So it's a centrifuge, it spins out. At the end of one day's collection, we'll look at those cells, we'll do a count. And if that meets that criteria, then we're done. If not, we'll do apheresis on day 2. Once the apheresis is complete, we'll send the cells over to the Dana-Farber cell manipulation facility, and they're responsible for freezing those cells, packaging them, and getting them ready for transport to Novartis. The estimated time that they give us is 24 to 28 days. Once Novartis releases them, they will ship them back to us frozen to the cell manufacturing facility where they will stay frozen in a liquid nitrogen tank until the doctors say that we're good to give it back. Then we're going to bring you back into the hospital when the cells are here. We're going to check to make sure you're still well enough to get them. The patients would get 5 days of chemotherapy conditioning just to wipe out any bad cells that are still circulating around and make room for the new T cells. And then the Kymriah gets infused. It gets infused over a half an hour. It's very small. It looks like a bag of blood, about 50 cc's, so less than 2 ounces. After your infusion, there is a risk that you could develop cytokine release syndrome, which is a known risk for any CAR T-cell product. And you could get quite ill with that. We may need to heighten our level of care for you, and you may need to get transferred to the intensive care unit. And we work in conjunction with our intensivists up in the intensive care unit so that they are collaborating on this with us. They know who the patient is, when they're coming in, they're well aware. If you need to go, somebody's expecting you. And then you'll be observed in the intensive care unit until you're stable, and then you'll come back downstairs to the bone marrow transplant unit. The window to develop that cytokine release is 3 to 22 days post-infusion. If we kept you until day 35, you're beyond the window and safe to go home.